This was then our mail order facility, which is so impressively robotic. There are machines and bells and whistles, and it's fast. Every step of the way here, there are people involved. And it struck me as interesting because there's people taking care of people at every step of the way. And that's what I thought was really interesting, because it's not mail order. It's really much more personalized.
Pharmacist also, and the thing that I liked is that he was like, opposed to retail, I don't feel like I need to get X amount of these out the door in this amount of time, and that I'm just pushing through the buttons, that if I'm putting my name on it, that I feel like I've really done my due diligence in order to clear any of the edits that needed to be cleared before it went out the door.
And the queue that he was working on at the time was retro DUR. And the thing that impressed me is he was going through his claims and saying, okay, here was a drug interaction, but I see the patient's had it before, and I know it's the same doctor. He was able to make, like a real pharmacist clinical decision, as opposed to, I think, so much of our stuff that we do is black and white, and go to line 4, if they say no, go to line 6. He was actually making a clinical, this is my decision, I'm taking ownership, I know I don't need to make an outbound call. And I thought that was really impressive, and something that we need to take pride in, is that yes, we're pharmacists, but we don't always just follow the box and fill in the lines.
So I'll be pretty quick, but my experience was just the knowledge of how such a big company we are, but then when we sit down and talk to these TRC pharmacists and nurses, that how dedicated they are and how closely they work with all these individuals and patients, that they know them. And then working with someone who wasn't even a technician, but they specifically worked on Zolar. That's what they did all day. And she knew the intricacies in and out. The physicians, she knew how everything worked. It was pretty amazing. So I was just surprised by that and very impressed. How well she knew the process, how well she knew how to get the system going, and then how easily they were able to triage those cases between the physician's office and then also to support staff to be able to get assistance for that. Like the member that you explained, the $2,600, these are very expensive medications, and so when a claim came in, it was very, very expensive, they were able to then triage it to someone else so they can get a discount program, and it all works so seamlessly.
In the billing department, her job was to make sure that the patients are kind of paying us correctly, and if they have any outstanding orders, outstanding bills. And the call came in from a little old lady. I think she was like 85 or 86 years old. You could tell she just had this little mouse of a voice. And she was calling in because she thought that she still owed us $2,600, and she was going to say, well, how can I make my payment to you? And the billing person pulled up her thing and identified her billing order and said, actually, no, ma'am, your balance is zero. It's the plan responsibility that's $2,600. Your current balance is zero. And I thought she was going to jump through the phone and give us a hug. I mean, she was, oh my gosh, I had no idea. Here, I thought I was calling to send you a check for $2,600, and I love you guys, and this is the best thing, the best news of the day. And sincerely, that's just one example. So I don't know, that to me it was very impactful to just feel this. So much of what we do feels like writing on a slide, and that's what's probably been, to be honest with you, probably one of my biggest hang-ups in our business now for the last 3 or 4 years is I'm just so used to preaching off the slides. You kind of get numb to it after a while. It just feels like writing on a piece of paper, but to be here and see it firsthand, for me, was very, very impactful. So I'm going to hear.
Yesterday, we ended with the nurse case managers, and I think that's very powerful. And anybody who's ever been treated in any type of care, that nurse who shepherds you from the next point of care is very impactful, the care and concern. And the nurse case manager was welled up with sort of glassy eye when she told the story about how she was trying to reach an older man, and every time she would call him, it sounded like there was just a group of children running in circles around him. And she said, hey, is this a good time to talk? He said, well, you're never going to get me without this group of people. And they got into this big, long discussion about how he's a grandfather. His wife had passed away. He has his children's children living with him. He has full custody of them. He had bone cancer. He had been late to fill his medication. And he said, you know what, to be honest with you, I can't even take care of myself, let alone, you know, follow up with all these things that I need to do with this medication. So this nurse case manager said, you know, we'll get back to you. We have a social worker that works in our organization. This social worker, and this is number one, a great thing for our company, a great thing for Credo, and a great thing to be an American. There are so many people out there that are willing to help other people. And she reached out to local church groups to support this man. They took his kids to school. They took them to their appointments, different things. And this guy was able to go and get the care, you know, to treat his bone cancer. And they were so proud to tell us that story, and I'm proud to tell that to this group because it was a wonderful story. And I left this session being very proud to be a pharmacist, proud to work for my company, and this is just wonderful stories that we have to find a way to get to our clients. It really moved me yesterday.
Passion, alignment, collaboration, respect. Well, no, I'm just saying, it was funny that all came through every person I sat with. I felt like they were passionate about what they were doing and helping the inpatient. You know, as a pharmacist, did I go to school to think about, sorry, lack of a better word, upselling things? Not really. I want to help patients. And ultimately, that's what they're doing. And that's what they're doing on our clients' behalves. So, to me, that's what it's all about.
Boston, wherever, it could be a you know, shortage of the drug supply, and they work through all of that, call those patients and arrange things. I mean, it's like they take care of each one of them, and I thought, well, that's awesome.
So that their job is to try to pick apart the emergency situations.
Yeah.
Try to figure out if there was
Contingency.
a contingency, if it's shortages,
Yeah, supply chain or.
we can't get it there because of the weather, UPS. Yeah, so they found the workaround to get that patient medication.
Wow. And the 9 boxes of Kaleido that I saw that. Thinking back to my retail days, I'm like, that's more than the inventory I carried in the pharmacy.
I was thinking about that too. I worked at Hennepin County Medical Center in downtown Minneapolis for probably like my years of pharmacy school and then a few years afterwards. And I remember back in the day, Atgam was the most expensive drug in the fridge. And when we would make up an anti-rejection of Atgam, it was like a big deal. And especially when you're like a second-year pharmacy student, you have thousands of dollars of drug in your hand, you would be all freaked out like, oh, what if I spilled it? And now, you look at some of these medications and we're talking, you know, you could have $250,000 worth of drug in your hand. I would be just panicked by that. I don't know.
Providers, clients, whatever, they want the best for their patients. They want us to provide the best service for their patients. And I think what I got from this is I'm constantly fighting XYZ other pharmacy, and they can do this and they can do this, and you're so big, and I don't believe that you can really get to know your patients. But the fact that we do have a social worker, and the fact that we do have a dietitian, I was blown away by that, and the fact that we have overall support. So I'm going to go back and say, do you know, for my client, their biggest trend right now is actually cancer. Someone say, you know what, 1 in 5 patients actually die or have something to do with their death with malnutrition. We look at that. What other pharmacy is going to do that? So for me, being able to look at the holistic patient, I think is what I'm going to take back to them.
More information around it, I think that we could really use that to help sell. And I know it changes a lot. The lady I sat with, she even had a post-it where just in the last week there were 3 new things that popped up for different drugs that she was now trying to, the Excel document that she was going through, that her manager sent her every day, and she had a list of clients, patients that she was responsible for. But just knowing that they're out there and that outreach that they're trying to help the patients, I think that story is invaluable to tell to clients.
One thing that I noticed, and we talked about when the pharmacists are in the hazmat suits mixing up the doses for the PAH. If you notice, like the last QC thing they did, they put on the scale. We just happened to be there at the right time to see that. So I was having a discussion afterwards with the young lady that did our IVIG presentation, and she had mentioned that what we found now since we've started doing that is a lot of people were actually overdosing themselves, or actually or underdosing. When we mixed the doses, the members were getting the right dose, which was more than they really needed. So it just shows a huge unmet need in that area. So.
Or sat with somebody from our prior authorization department, somebody from the CRD. And it was just for a few minutes, but it really opened my eyes.
Drug that they were working with, but they were putting it in a cartridge so that the patient didn't have to do that any longer. And just those little things, I think, really make a huge difference.
Let's go drug list for 400.
Screen and run the determine a client specialty reported drug.
34. 36. It's not in the form of a question. What is 34?
That is correct. Program has been priced for most new and renewing clients beginning in April 2014, and standard version requires a 9-day benefit for specialty. No?
I think you did.
I gotta watch you. Clinical day supply. That's right.
And a call came in from an old lady. Well, elderly lady, sorry. That was a neighborhood member, and she was calling in, or she received an automated call. It's time to refill her Fondaparinux. And so she was calling back. And as you can imagine, it being the first of the year, not the end of the year, her copay, her responsibility was quite a bit greater. It went from $8 to $155. And she didn't have any copay assistance on file, and of course it'd have to be a foundation. And so the customer service rep was offering that to this individual, and she was like, yeah, that sounds great. And so she's searching that spreadsheet, that reference point that she had, and of course couldn't find Fondaparinux listed on there. And I said, well, is a Rixtra listed on there? And so it was under a Rixtra, but that person wouldn't have had that information had I not been sitting there to be able to provide the foundation information. So just one of the pieces of feedback I gave Tom yesterday was that that they should have the brand generic names listed on there for those customer service reps. So I think, you know, we were able to provide some value to them, even though they were providing much more to us. But one of the last comment I was going to make was I had just this huge feeling of pride yesterday when I was sitting in that copay assistance section. Chris Kelly can vouch for this. One of the things we got beat up about last year early on quite a bit was this perception that our specialty pharmacy didn't offer assistance to members, and that some of our competitors would offer it to every patient regardless if they asked. And so to see that we have that oral oncology team that's proactively providing assistance to members was huge. And I don't know if you all heard the numbers yesterday. They said from May through December, there was 2,100 patients that they helped to the tune of about $25 million in assistance. And then just in January of this year, they re-enrolled 1,500 patients, and it was something around $20 million that they've already helped patients this year. So those are huge stories for us to be able to tell our clients.
And I can echo a lot of people, but I think the thing that resonated with me was I have this kind of life philosophy, so not to get all woo on you, but I have this life philosophy that, you know, the best way to interact with people is meet them where they are. You meet them where they are. And I saw that day, or every single station that I went to yesterday, all those people were meeting our patients where they are. And I think that's one thing as a group, or maybe as an organization, that we don't do very well for our clients. We don't meet our clients where they are. We try to pull them to where we are, where we want them to be, and while that's our end goal, we need to do a better job of meeting them where they are and explaining to them that on an operational level and as we service their patients, they are doing that, have good examples of that, and then help them come with us on the journey. So that was my biggest learning.
Credo,